My name is Margaret Richiru. I'm a veterinarian. I work in the wildlife sector, and I'm very passionate about issues of disease control and epidemiology. Thank you.
Test.
Welcome. We look forward to hearing your presentation. I'm Jeff Bender. I'm an infectious disease epidemiologist with a focus on public health at the human-animal interface.
Good morning. I'm Laura Bloomberg. I'm the Dean of the Humphrey School of Public Affairs at the University of Minnesota.
Good morning. My name is Marilyn Crane. I'm a Senior Technical Advisor for the Emerging Threats Division in Washington, D.C. For USAID.
Hello, I'm Katie Pelican from the University of Minnesota. I'm a veterinarian and a wildlife veterinarian by training, but now find myself a One Healther in all aspects of my life. So.
Good morning. My name is Andrew Thaya. I'm a veterinarian and currently an infectious disease specialist working for USAID Kenya and East Africa.
Yes. Ladies and gentlemen, good morning. Welcome as we take you through a comprehensive strategy to address challenges presented by the novel, highly pathogenic virus in the East African country. I'm Guyo Joseph, a vet student.
Elizabeth, nursing student.
Walter Nyaga, pharmacy student.
Samantha Mkonja, medical student.
Is medical student.
Lucy Nuta, dental student.
I had a bat. Its name was Enza. I opened the window and in flew Enza. Children sang innocently during the 1918 pandemic that resulted in the death of close to 50 million people. By 1940, the avian type A and B have been discovered. The first human case for avian influenza was discovered in 1997 in Hong Kong. Since then, there have been various outbreaks in Uganda, Sudan, South Africa, and the latest being reported in Kenya last week. I'll take you through the background of what influenza is. This is an acute viral disease that is affecting various animals and humans. There are various types and strains, that is type A, B, C, and D, that affects both human and animals. There are two main variations that occur in avian influenza. The first one being antigenic drift, which involves point mutations on the hemagglutinin and neuraminidase that results in formation of novel constellation. And antigenic shift, which involves the sharing of influenza, either from human and birds, resulting in a different or a new highly pathogenic virus. We look at the basic epidemiology of this. It's worldwide. It has resulted in epidemics, and it's endemic currently in Egypt. The modes of transmission: ingestion, inhalation, coming in contact with fomites, and direct transmission for humans. Clinical findings for low-level pathogenic avian influenza. Basically, we have subclinical signs, and highly pathogenic involves the severe signs. The basic prevention and control, the first defense line in an outbreak of avian influenza is surveillance and reporting, mainly by active or passive reporting. Biosecurity, which involves the use of disinfectants, humane culling, as well as behavioral changes and proper disposal of the culled or the dead birds, and vaccination.
So we have a problem, and our problem is the influenza outbreak, which is now an epidemic, and this epidemic is at risk of being a pandemic. The root causes of our problem is that we have weak communication channels. We also have inadequate allocation of resources, and also another key root problem is there is no active surveillance. This has also brought about loss of biodiversity. Since we have the birds dying, we also have underreporting of cases. We have straining of resources, and also we are at risk of economic crisis. we take a look at the SWOT analysis, where we find that we have the strengths, the weaknesses, the opportunities and the threats. On our strengths, we have the government is willing to offer funds for us to deal with this present epidemic that we're facing. Then on our weaknesses, the main weakness that we have is communication channels, and also lack of knowledge on this disease and how it occurs. It's also a problem. Then on our opportunities, we see that the Ministry of Health is coming up with training programs to train those people in the health systems in order to curb the epidemic and stop the spread. We also have vaccine already present in the community or in the government, ready to be used. On our threats, we see that the referral hospitals are far from one another, so when you refer a case, it's easier to spread a condition. And also the number of staffs in the hospitals are very limited. We find that there is high cost of medical service. This is a problem in every developing country. We take a look at the stakeholder analysis. The stakeholder analysis, we look at the power. We look at the power and the interest. The power is the interest is how willing are you to tackle the problem at hand, whereas the power is what you're willing to give in order to tackle this epidemic that you're facing. Then we find that the Ministry of Health, the Ministry of Agriculture, and the Ministry of Wildlife and Lifestyle really play a big role in order to tackle this epidemic that we are facing. This, after analyzing the stakeholders, we take a look at, we took 4 approaches that enabled us to come up with interventions to curb this epidemic that we're facing. That is the One Health approach, the value chain approach, the sustainability approach, and also the innovative approach. These 4 objectives we use in order to come up with our interventions. But the big question still remains: are we able to live in a country free from flu? Thank you.
So, to live in a world free from flu, we came up with 3 thematic areas on which our interventions were based. So, the 3 thematic areas are basically mitigation of fear, that is mitigation of fear of the disease and loss of livelihood, prevention of disease spread to non-infected persons and poultry, and cross-cutting issues and future infrastructure. Now, we also allocated various amounts of our budget in these thematic areas. However, we have a slight error in this slide, which we apologize for, but I will explain to you on how we allocated the budget. So, the budget allocated to us was $700,000. However, based on our projections, we worked with $2.1 million, which was allocated as follows. In mitigation of fear, this was 18%. This took 18% of the budget, which is $378,000 US. In prevention of disease spread to non-infected persons, this was 50% of the budget, which is basically $1,050,500. And in cross-cutting and infrastructure, this is 13% of the budget, which is $265,000. And the remaining 18%, which is $106,500, this came to contingency in case the outbreak went beyond our means. So in the case of the deficit, that is the difference between the $2.1 million and the $700,000 were given, we would apply for grants basically from the World Health Organization, Food and Agriculture Organization, and the OIE. So fear, we all know that fear is a state of mind. Our first thematic area was to mitigate fear of the disease and the loss of livelihood. And how would we achieve this? We came up with outcomes and activities towards this, and a time frame together with the resources and the budget, as illustrated. So our first outcome would be to achieve a community that is aware of the disease and its impact on livelihoods. The various activities that we would carry out to achieve this would be to conduct education campaigns on the disease and its impact. This would be achieved by carrying out education on signs and symptoms, proper health behavior, and prevention strategies, and also the disease and its transmission. We would also debunk myths regarding the disease, myths such as people say flu is just a bad cold, or rather the vaccine could make one more prone to the disease. Yeah, so debunking myths would be key, especially in killing the epidemics of rumors. Another outcome would be employment of innovative approaches to reach more communities. This could be done by various activities such as developing a mobile application or a website to support dissemination of information and outbreak response. This could be done also by the media within the local and regional communities. Another outcome would be to reduce the impact of the disease on livelihoods and the GDP. This could be done by diversifying the sources of the GDP, by tapping into other alternatives such as gold, copper, and oil mining, and reducing the focus on poultry farming. We would also give a press conference on the disease control updates to alleviate fear in investors and tourists and reduce the fear of loss of livelihood, especially in the tourism industry. And we would also restrict close contact and exploration of wild bird sanctuaries, especially in respect to the tourists visiting the various sanctuaries. And finally, to reduce the impact on livelihoods, we would train and support communities to engage in alternative sources of livelihood.
So, as we all know, prevention is better than cure, and that's to our advantage. Sorry. So, in considering this, we came up with a strategy that would enable, number one, us to achieve a better response in terms of coordination and information flow within this archetype community, which you're considering is East Africa. So the first thing we want to do is set up an information desk where if any member of the community has a challenge, they can go online and find information concerning the disease. The second thing we'd love to do is develop protocols and deploy them to the community so that they're able to understand the challenges that we are facing, take the necessary precautions. Also sharing information with partners such as the OHCEA, which is the World Animal Organization, and the WHO platforms. On preventing disease, our next outcome, the one that we wanted to take, is reducing the risk of spread from the disease by protecting the risk population. And you should ask yourself, what is the risk population at this moment? For us, our risk population are that those women in the maternity wards. We are having this under 14 in an East African population. The under 14 are at risk of having influenza. We're talking about immunocompromised population. And as you can see from the prompt, we had a deficit in terms of vaccines. So one of our goals is actually to procure vaccines. The other thing we want to do is impose movement control. If we can't treat them, let's control them. Let's limit the disease. Then we want also to review health messages conveyed by the Ministry of Health to ensure that the messages that are reaching the population, for instance, are accurate, comprehensive, and take into consideration things like social marketing, because as we all know, behavior is hard to change. Our third outcome was to reduce the mortality through better management, and management for us meant we deploy antivirals, PPEs to the community. Also produce and distribute information concerning the case so that the various stakeholders are able to understand the intensity of the situation and respond as they should. We also wanted to aim at managing patients according to their needs, in line with the referral guidelines provided by the WHO Pandemic Influenza Preparedness Plan and other structures like the International Health Regulation. And as we all know, the big thing, global health security, which is part of our agenda here in this, even as we meet. Then, lastly, also to increase coverage and sustain outbreak control. And as you notice, all this require an immediate response and therefore require immediate funding.
Ladies and gentlemen, we all know that outbreaks have the capacity to disrupt economies and societies. It is therefore in the best interest that we have collaboration between various sectors. So you're proposing two activities here, resource mapping, and then also holding consultative meetings with key stakeholders to achieve collaboration that will prevent the disease from becoming a pandemic. Two, we want to put in place quality infrastructure, which includes strengthening the national disease reporting and information management systems. We want also to leverage on political goodwill, and we also want to equip first-line centers using the One Health approach. We want to make it, our approach is innovative and sustainable in a way that we are proposing that we do research in poultry and birds so that we find a way to control the influenza while it's still in birds. We also want to promote those approaches that are environmentally friendly, and also we want to do capacity building so that the workforce is ready for this. As a colleague talked about website and an application, that is just an illustration of how the system can be like to address this influenza by coordinating all the various stakeholders involved. Thank you.
Now, we have already said what we want to do to take care of this problem. But even as we take care of this problem, we need to continue monitoring and evaluating to make sure we are reaching our goals. So how we are going to do this is to measure our objectives and look at it in terms of an objectively verifiable indicator. And the way we'll do this is to look at management evaluation reports. So for example, we look at the objective of to mitigate fear on HPAI and loss of livelihood, and then C, a measurable thing is to look at a percentage of the community has improved in its attitudes towards the measures.
Thank you. So now we move to a strict 8-minute, exchange with the judges. So we'll want to start.
Yeah, thank you very much for a very beautiful presentation. It's very well organized. However, I don't see where you brought together a national task force to deal with this and how you brought in all the other stakeholders. Did you meet with them? Were you meeting regularly? In the outbreak response. It didn't come out clearly. How did you organize your outbreak response?
So I get your question in terms of how did we organize our task force. So it was based on, we want to have people who are major stakeholders in terms of their interest in the case and what they can bring into the table. Yeah. So, for example, ecologists, socialists in terms of mitigating fear. We look at veterinary, the people working at the vets, because we're working with poultry. We want to look at people in human medicine, because this the epidemic we're dealing with also can affect humans. So it is in the perspective of people who can help those who have the power and the will in dealing with this epidemic.
What I'm saying, I saw a very good outline for your budget, but I did not particularly see an equivalent strategy for response, for surveillance, infection prevention and control and things like that. So I'm wondering how you would like to convince the panel that you can be given funding.
Thank you for the question. So the first thing that we did when we were considering the budgeting was look at previous frameworks and what exactly they do and how they solve the problem. And how we've broken down our objectives is what a few organizations take in. So for instance, when you're talking about mitigation of fear, we're talking about prevention and control of the infection. That's actually what we considered when applying for. I don't know if I've answered your question. Applied for the budget. So
in terms of our strategy, who are you going to vaccinate, for example?
So we did, I think it explained better, we did an equation using RO.
Basically, we looked at the vulnerable group, which is the age of between 0 to 14, as well as those above 65 and the immunocompromised. So we decided to use the reproductive number, that is RO, which indicates that 1 minus all over RO will give us the vulnerable population. So we consider that in the Alois village, we got 45% who are 0 to 14, and we assumed for those above 65 years and the immunocompromised to be 55%. That gave us a total of 50%. So the population that is vulnerable, according to Alois Village, is 50% of the 40 million that is present. That gives us 20 million. Now, the herd immunity theory is that of the 20 million, according to RO, we assume that our RO for avian influenza is 2, according to Mills et al. And www.cambridge.com, which gave us a variance of between 2 and 3, and we used 2. So 1 minus 1 over 2 gave us 0.5. That is 50% of the vulnerable population, which means 50% of the 20 million, which gave us 10 million. And that is available in stock as indicated by the government. Thank you.
So I noted that you did a mapping of the stakeholders with power versus interests, and I was wondering what the basis for the allocations on the mapping was. And if you have a little time, also just tell us how you came up, what was the approach as well to the SWOT analysis, so both.
So when it came to the stakeholder analysis, we put across, we have a problem at hand. This problem that is at hand, who can we approach and what are they bringing to the table? Like now we are building a table as us, and we want people we can deal with at the table to deal with the epidemic that we are facing. So we have the Ministry of Health. The Ministry of Health, they work directly with the government, as in the government themselves, and they're the people who will facilitate, will come up with medical supplies, medical aids in order to help the people who are being affected. They're the ones who are going to come up with the strategies or the ways of vaccinating people. So for them, they have the highest interest in the case because they're the people, including the epidemiologists. They understand the disease better than anyone else. So they have the interest, and their power is high. What they're bringing to the table is also high. So that's how we considered Ministry of Health. Then when it came to Ministry of Agriculture, we find that the poultry, we have farmers, and the farmers are under the Ministry of Agriculture, and the people who are keeping this poultry and chicken and geese and all that. So the Ministry of Agriculture also is concerned that they are losing farmers, or they are losing cases due to poultry. So their interest is also high, and they also work together in the government, so they can also ask for funds, or they can ask for interventions easily from the government, or put across agendas to the government. So we come to the Ministry of Tourism. We have the issue of wild birds migrating, the issue of wild birds moving from place to place. So they also have a big role to play in explaining and understanding the way this disease, the way the birds migrate and everything. So we come to the media. The media, they're neither interested, nor do they, okay, they have the power and they have the interest if they are involved. That's why they're in the middle. If we contact them for them to help us out, that's when they will have the interest and they will have the willpower, or they will put in their resources to help us to curb this epidemic that we are going with. The ecologists are very interested because the birds are dying and the environment itself is affected. Then we come to the community. The community doesn't have the power to deal with what is going on.
Thank you. Time is over. Thank you very much. A good clap for them.